Good morning, everyone. Um, my name's Adam from New Forest Physiotherapy Clinic, and I'm just going to tell you a little bit about the clinic and what I do at the clinic. So that's a view of the inside of the clinic there. I actually converted my garage. It's been open for 2.5 years within the garage, but I've actually been functioning as New Forest Physiotherapy Clinic for a very long time, since about 2010. I was one of the original members, actually, of this group when it used to meet down in Ashlock Creek in the clubhouse there under Darren. So that's the picture from outside. So the clinic is the door on the left there, which used to be the garage, which is now the clinic. It's very clinical, and once you're in there, it feels like a proper physio clinic. So I qualified in 1994 from the University of Birmingham, so I've got a lot of experience. In 1997, I got a postgraduate certificate from Sheffield Hallam University, management of the acutely ill patient. And in 2009, I got a postgraduate diploma from Southampton University in rehabilitation science. So I've got a lot of the academic backing to the job as well, but obviously physiotherapy is very much a hands-on practical job also. It merges theory and practice very nicely. I've worked in the private sector, the NHS, and with the military. First job was in Yeovil District Hospital, where I live in Somerset. Then I did rotations through the Northern General Hospital in Sheffield. I've worked in Macclesfield. But then in the year 2000, I bought my house in Southampton, and ever since 2000, I've been down in this area. Worked at the Spire Hospital, Southampton, which is the old Bupa Hospital. I've also worked at various military camps, Tidworth Camp, where there's a hospital there. When I was there, the hospital was basically empty. Unfortunately, in more recent times, Afghanistan, Iraq, it would have become busy. Bovington, where the tank training place is, and at Middlewallop. Middlewallop was interesting, so that's where they train the helicopter pilots. They get a lot of vibration from the helicopters, and they tend to get back problems, so I treated a lot of back pain there. Also did 20 years in the Army Reserve. So I treat various conditions. That's my dad there, posing as a patient. Back pain and neck pain is a lot of it. So I've mentioned in my 1 minute about whiplash. That's a big chunk of what I do, actually, because you're covered by your insurance, and one of the companies I work with gets referrals through insurance companies. Back pain is also a huge chunk. People adopt poor postures sitting. Looking around the room here, there's a few poor postures. But the body's not really designed to be sat. The body's designed to be up and moving around. But of course, we sit for 6-7 hours a day, or some people do, depending on their job. Sports injuries, that's not such a big part. It has in the past been a big part, especially when I was working with the military. But I don't tend to see so many sports injuries now. But I have a lot of experience treating them when I was in the military. They used to get all sorts of foot problems, tendinitises, and you would have to try and keep them going. They'd be on a course. That course might last 3 months, and what they don't want is to be back squatted and have to do the whole thing all over again. So if they pick up an Achilles tendinitis or some kind of injury, they'll want to push through that. And so whereas with a normal civvy, if you like, you would say, well, just rest and let it recover. They can't really do that. So you have to try and sort of help them get through it, and as best you can. Otherwise, they'll fail their course and have to redo it. Arthritis. So that joint should look like smooth marble. Those pink bits on the joint surface is where the hyaline cartilage is worn right the way down to the bone. Unfortunately, as we get older, the hyaline cartilage dehydrates and gets thinner, and that leads to arthritis. Here's some other conditions I treat, but the pinger has gone, so I shall whiz forwards. We do treatments available: ultrasound, acupuncture, manipulation, mobilization, and the other thing to mention before I stop is I run a hip and knee class and a back care class at Marchwood Village Hall. So the hip and knee class is good for anyone with arthritis who's had a joint replacement. Back care and core stability class for anyone who's had back pain. So if you're interested in that, it's only £10 a class, 9:30 and 10:30 on a Friday morning. There is an online version of my back class, by the way, if you go to my YouTube channel. Brings me neatly onto the last one. You can look us up on social media. Just look for New Forest Physio, Facebook, YouTube, and on Twitter or the website newforestphysio.co.uk. Any questions? So an assessment for an hour costs 65. Follow up for 45 minutes is 45. Or I'm covered also with insurance, Bupa, and AXA, all the main sort of companies. If you've got insurance, then I can cover you through that. Sometimes people don't realise they're covered through, if you're in a union or trade union, like I had some people coming through, they were teachers, and there was a school and teachers union, and they were coming through that. It's a massive industry, it's billions of pounds, thousands of operations every year. And actually the NHS follow-up isn't that good in terms of physio. They tend to send you off with an exercise sheet and then don't follow you up until there's a problem, which it's far better to have the physio and prevent the problem in the first place, really. But yeah, no, it's massive. There's loads of, you probably walk past several people today who's had a knee replacement. So I admire GPs. They get 10 minutes per patient, and in that time, you can take some older people 10 minutes just to walk through the door and sit down, and then get up and walk back out again. And they've got to do a prescription as well. So, and they're not experts on musculoskeletal conditions. They've got to be an expert on, or a generalist, aren't they? They're generalists on everything. So you've got to, in that time that you're in there, they've probably only got, like, here's some painkillers, off out you go. Whereas a physio, you've got an hour to assess you. You can really pick the problems apart, and we're bespoke. So not everyone's the same. So someone, Ethel, with a bad back, probably just wants to be able to walk down to the shops, get some shopping, and walk back again. Whereas Carl, the sort of gym queen who lifts 100-kilo weights over their head, is clearly going to need to function at a higher level. So it's bespoke to the individual. Yeah. Thank you very much. Thank you.